Welcome to the deep dive. Today, we're venturing into a really fascinating, if maybe a little unsettling area.
Yeah.
We're talking about encephalitis in animals. But here's the twist.
Yeah.
It's caused by parasites that have, well, taken a wrong turn and ended up somewhere they definitely shouldn't be the brain.
Mm-hmm.
Now, I know what you might be thinking, but trust us, there are some genuinely surprising facts, some real aha moments waiting for you here.
Absolutely. We've been looking at some really interesting, detailed information on this specific kind of encephalitis.
Right.
And our mission today really is to understand how these parasites, which usually aim for totally different parts of the body, can end up impacting the central nervous system.
And what signs to look for?
Exactly. What are the warning signs? And also, why does understanding this, even if it seems a bit niche, actually give us valuable insights into animal health overall?
Okay, let's jump right in then. So the
Yeah.
basics first. We're talking about inflammation of the brain that's encephalitis.
Right.
Triggered because a parasite has migrated, sort of wandered off its normal path into the brain or spinal cord.
Yeah, it's like it took a major detour. Aberrant migration is the term. These parasites usually have very specific destinations.
Like where?
Well, depends on the parasite. Some live in the heart, others the intestines, some even the skin. So the fact that they can even rarely end up causing these serious neurological issues, it's pretty remarkable.
And the information we have lists some of the culprits.
Oh yeah, quite a few actually. You've got heartworm, Dirofilaria immitis.
The one dogs get.
That's the one. Then various tapeworms like Tasnia species, hookworm, Ancylostoma caninum.
Okay, common stuff so far.
Relatively common, yes. But then it gets more specific. Various Angiostronglus species, the dog roundworm Toxocara canis, and then some you might not know, like the raccoon roundworm, Balancoceras procyon,
Raccoon roundworm?
and the skunk one, B. columnaris. Plus, there are larval tapeworm Cis cornuris and Cysticercus cellulose, and even botfly larvae, Cuterebra.
Wow, Cuterebra. Those are nasty looking. So, quite a rogues gallery.
Hmm.
The main point being, lots of different parasites could potentially do this, even if it's rare.
Exactly. Think about heartworm, normally heart and lungs, right?
Yeah.
Tapeworms in the gut. For them to navigate to the central nervous system, it's quite something.
So how do they manage that? It's not like there are signposts pointing to the brain, presumably.
No, definitely not. The info suggests a couple of main routes. One is through the bloodstream hematogenous spread, they call it.
Like catching a ride in the blood.
Precisely. And heartworm Dirofilaria is mentioned as a prime example of using this route.
So the worms get from the heart.
Yeah.
All the way up there. That's kind of mind-boggling.
It is. The other main way is sort of burrowing in from nearby tissues.
Okay, like how?
Imagine finding a weak spot. The text mentions the middle ear, little openings in the skull foramina, the cribriform plate, which is, that bony bit separating the nasal area from the brain.
Right here, the nose.
Exactly.
Yeah.
And even open fontanelles, those soft spots on a young animal's skull. Cuterebra, the botfly larvae, are particularly linked with this route. Makes sense. You can picture a larva kind of wriggling through.
Yikes. Open fontanelles.
Yeah.
Creepy. Okay, so who gets this? Is it any animal, any age?
Well, the signalment, as it's called, gives some clues. For the heartworm-related type, it tends to be adult animals.
Okay.
For many of the others on that list, it seems to be more common in younger dogs and cats, especially ones that go outdoors.
Makes sense. More exposure risk.
Definitely. But it's crucial to stress, this is still considered pretty rare.
Yeah.
Sporadic.
Right, good point. Not an everyday diagnosis. But if it happens, what would you actually see? What are the signs? Must be quite varied.
Hugely varied. And often asymmetrical, meaning worse on one side than the other. It really depends on which part of the brain or spinal cord is affected. The signs can sometimes mimic, say, a brain tumor, a focal lesion, or they might suggest a more spread out multifocal problem.
Can you give some specific examples? What might an owner notice?
Sure. For Cuterebriasis, the botfly one, there's often a seasonal link, July to October, roughly.
Summer or fall?
Yep. And the onset can be really fast, acute, or peracute. You might see sudden behavior changes, seizures, maybe vision problems. And interestingly, the text needs a common history of previous respiratory issues.
Like a cold or sniffles beforehand? Why would that matter?
Well, the thought is maybe that initial infection could weaken barriers near the nasal passages, potentially giving the larva an easier entry point. It's a theory.
Interesting connection. Any others?
Yeah, the text mentions a rat parasite, Angiostrongylus cantonensis, seen in Australia. In puppies, this one can cause what's called a lumbosacral syndrome,
Big name.
problems with the lower back area. So weakness or paralysis in the hind legs, the tail, maybe bladder control issues.
Oh, boo.
And sometimes it can even ascend, moving up to affect the front legs and even the cranial nerves in the head. Sounds really awful.
It really does.
Right.
So what puts an animal at risk for these kinds of CNS invasions? You mentioned outdoor access.
Right. And specifically, the text points to housing, like in a cage or enclosure that used to hold wildlife. Raccoons, skunks.
Ah, because they carry specific parasites.
Exactly, like Balis ascaris, the raccoon roundworm we mentioned. The wildlife sheds eggs or larvae, contaminating the environment, and then the pet picks it up.
Like invisible landmines.
Mm-hmm.
Okay. Now, diagnosing this sounds challenging.
Extremely challenging. The text is pretty clear that a definitive diagnosis often only happens after death, at necropsy.
Wow. So while the animal is alive, it's mostly guesswork.
Not guesswork, but working through possibilities. Vets have a list of differential diagnoses for neurological signs.
What else would be on that list?
Other infections, viral, bacterial, protozoan, fungal encephalitis. Then there's an inflammatory condition called GME, granulomatous meningoencephalomyelitis, and, of course, brain tumors.
So lots to rule out. What about tests? Can any tests give clues?
Standard blood work, urine tests usually normal, the text says, unless other organs are involved too. Analyzing the cerebrospinal fluid, the CSF, can sometimes help. You might see increased white blood cells, eosinophils, neutrophils, mononuclear cells, signs of inflammation.
Like the body fighting something off.
Exactly. But this can happen with other infections too, so it's not specific. And sometimes, if the parasite is just burrowed deep in the tissue, the CSF can look totally normal.
What about brain scans? CT or MRI?
They can be useful. You might see focal lesions, areas of damage, maybe even signs of a stroke cerebral infarction if a parasite blocks a blood vessel.
So you might see something is wrong, but not necessarily what it is.
Often, yes. The findings can be nonspecific. However, the text does note that imaging might lead the vet to consider surgery. And during surgery, they might actually find and remove the parasite. That would be diagnostic and therapeutic.
Right. So if they do find evidence, either through imaging, surgery, or unfortunately necropsy, what does the damage actually look like?
It varies. You might see the parasite itself or just the tracks it left behind, or maybe not even that. You could find areas of infarction tissue death from lack of blood supply. There might be signs of bleeding from ruptured vessels or emboli blockages causing necrosis, which is tissue death, or malacia, softening of the tissue.
Sounds pretty destructive.
It can be. You might also see granulomatous inflammation, the body trying to wall off the invader, or even hydrocephalus fluid buildup if the parasite blocks CSF flow.
Grim picture indeed.
It is, and specifically for heartworm, the worms might be inside blood vessels or outside, causing inflammation. And there's that specific link mentioned between Cuterebra
The bot fly larva.
and feline ischemic encephalopathy. That's basically a stroke in cats. Cuterebriasis is suspected as a possible cause.
Okay, so given how serious and tricky this all is, what about treatment? What can actually be done?
Well, if it's Cuterebra and it's accessible, surgical removal is an option, as we said.
Right.
But here's a major caution from the text. Using standard dewormers, parasiticides, can sometimes make things worse.
Worse. Why?
Likely because killing a bunch of parasites inside the brain all at once could trigger a massive inflammatory reaction, and more inflammation in the brain is not good.
Yeah, definitely not what you want. So if dewormers are risky, what's left?
A lot relies on supportive care, good nursing, managing symptoms. For heartworm in the brain or that neural angiostrongylosis we talked about, typical anthelmintics are risky, potentially fatal even.
Okay.
However, the text does offer a glimmer of hope. Milder cases of neural angiostrongylosis in puppies might improve with just supportive care and corticosteroids to manage inflammation.
Steroids to calm things down.
Exactly. And there is a specific protocol mentioned for suspected cuterebriasis in cats.
What's that?
It involves a single dose of ivermectin, that's an anti-parasitic drug, but crucially it has to be given after pre-treatment with an antihistamine like diphenhydramine.
Benadryl?
Essentially, yes. And an intravenous corticosteroid, dexamethasone. The idea is to try and dampen any severe reaction to the larvae dying off from the ivermectin.
Okay, so a very cautious approach.
Very. And then you'd also use corticosteroids or NSAIDs generally for inflammation and maybe antibiotics if there's concern about secondary bacterial infections. It's a real balancing act.
Definitely sounds like it. And after treatment, assuming the animal survived the initial crisis.
Follow-up monitoring is key. The text notes. How much and for how long depends on the severity and the specific case.
Makes sense. And what about preventing this nightmare scenario in the first place?
Prevention is mostly about reducing exposure risk. Keeping pets indoors helps, or at least keeping them away from areas with lots of wildlife, especially if you know certain wildlife parasites are common in your area.
Like avoiding those contaminated cages we discussed.
Exactly. And of course, using regular year-round parasite preventives recommended by your vet for heartworm, intestinal worms, that helps control the parasites that could potentially migrate.
Standard prevention is key then.
Absolutely. It's interesting, the source material lists NA for possible complications.
Yeah, I saw that. Maybe just focusing on the direct effects.
Probably within the scope of that document, yeah. So, finally, what's the overall prognosis? If an animal gets this, what's the likely outcome?
The text describes the course as either starting very suddenly or more gradually. But unfortunately, it's usually progressive, meaning it tends to get worse over time.
Not a great outlook generally, then.
Seems that way. So, wrapping this up, it's really quite something, isn't it? These common or sometimes uncommon parasites that we think of affecting one part of the body
Yeah.
can, in these rare instances, take this incredibly dangerous path into the brain or spinal cord.
Leading to some really serious neurological consequences. It definitely underscores how complex and interconnected biological systems are.
For sure. And even though it's rare, understanding that this can happen gives us, a fuller picture of animal health and the weird things that can sometimes go wrong. And it really drives home the importance of that routine preventative care.
Absolutely. And maybe it leaves you, the listener, with something to ponder. Just think about that intricate relationship between species, a parasite and its host interacting on this microscopic level, and how slight deviations, a wrong turn, can have such massive, unexpected health consequences. It really highlights the interconnectedness of life and maybe how much we still have to learn about the biological world around us and inside us.